All right, welcome to Tech Friday. In a bid to enhance medical emergency response in Nigeria, tech innovations are playing a critical role in bridging gaps in healthcare access and efficiency. From mobile apps for real-time ambulance tracking to AI-driven systems for faster diagnosis, technology is revolutionizing how emergency services are deployed, potentially saving thousands of lives in critical situations. As Nigeria faces ongoing challenges in healthcare infrastructure, these digital solutions offer a promising way to improve response times and overall patient outcomes. Folake Owodunni is a co-founder and the chief executive officer at Emergency Response Africa, and she joins me now to discuss this latest development in the world of tech. Good morning, madam.
Good morning.
Hope you had a great week.
I did. Thanks for having me.
Technology for transforming healthcare delivery. Try to expatiate for me tech-driven solutions that will be deployed for a country such as Nigeria.
Okay, so as we all know, emergencies happen every day, and in a place like Nigeria, everybody is affected. Unfortunately, when those emergencies happen, oftentimes we don't really know what to do. We do have a national emergency number. We have, in fact, multiple state emergency numbers. But if you ask the average person, okay, what do I do when there's an emergency? Most people simply don't know what action to take. When you then layer on the issues around the availability of ambulances, the fact that most of them are privately owned, they're not connected to any sort of central network, it makes for a very difficult situation in terms of getting people the care they need wherever it is they are at the point they are. And so deploying technology in our case is really about using tech to bring all of the different stakeholders together in a centralized network so that if somebody is having an emergency in one location, we can identify and dispatch the closest available response team to get to them, pick them up and transport them to the right place for additional care.
Saving lives, saving
Absolutely.
lives. Response time, time to execution, very important for healthcare delivery. So here we go with mobile apps, telemedicine, data management services, all of this together in a portfolio that you're talking about.
So what we have is a central, what is called a command, control, and intelligence dispatch platform. And what it means is it takes all of those resources, like I said, the ambulances, the responders, puts them all into one network and allows us to capture the data associated with any emergency. So when someone is calling, usually they're saying, oh, this particular thing is wrong with me. These are the symptoms I'm experiencing. We have a medical dispatcher that is trained to triage that case. So they're asking certain questions to understand the severity of the emergency. All of that data gets captured. It also gets transferred to those in the field. They can respond, they can provide treatment if needed, they can transport to a hospital. Again, all of the data associated with that gets captured. So by the time you get to the hospital, 24 hours after, usually we're following up with the patient to understand how did it go, or maybe the patient's family member, depending on their condition. All of that creates a comprehensive picture of the emergency case. And that data is highly relevant to decision-making in the long term, especially when you think about government. They want to know, for example, what emergencies are affecting people, what are the risk factors associated with those emergencies, and what's the right resources, where should we allocate resources to be able to better address. So that data becomes really, really important.
Are we talking about all of these tech-based solutions for urban centers or including rural communities in Nigeria? When you look at traffic gridlock in places like Lagos, Kano, and elsewhere, do you think we have solutions that could help folks in mega cities such as Lagos and those who are in rural communities as well?
Absolutely. So, I mean, one of the things we do at Emergency Response Africa is provide different vehicle types. So in addition to a standard ambulance, we also have motorcycle medics that are able to dispatch. But one thing I want to talk a lot about is rural emergency transport. So we launched a project recently with the Ogun State government, the Ogun State Ministry of Health, to provide emergency transportation for pregnant women in rural areas. So we actually started in Odeda local government. And when you think about a rural area, you know, road infrastructure is not great. They may have to travel long distances. And one of the things that we saw very clearly was women are having to get on Okada. Imagine a woman who is 8-9 months pregnant, getting on an Okada, trying to get to care, either for antenatal care or because she's experiencing labor complications. It's very difficult. I mean, I've had 2 children. I can't even begin to imagine. And so in that type of situation, the government had actually invested prior in ambulance tricycles. But what we see, and this is across Nigeria, is some of these vehicles are really underutilized. They just sit there or they're being used for other things. And again, it goes back to the technology and that lack of a central network. network. And so being able to collaborate very closely with the Ministry of Health in Ogun State, bring those vehicles under that central network and empower community members to be able to actually drive those vehicles and transport women. What we're seeing is that more and more women are using this system to get to their antenatal care appointments, which is a high predictor of them having a safe delivery in the future, and also to access care whenever they actually have an emergency. And maybe I'll just say one other thing. It's not just about the women themselves. Think about, where in Nigeria, people tend to patronize traditional birth attendants. They tend to go into churches even, in order to have their babies. By creating this system, we're seeing a lot more referrals, both from the community into the healthcare system and from the primary healthcare up to secondary and tertiary levels.
Sounds very robust in my ears, and looks like one of the ways in which we'll go ahead and reduce maternal mortality, infant mortality, and all of that in Nigeria looks very important. But you've got to work with the public here and the private sector, I mean, to talk about in terms of all of this. How can this initiative serve as a model for similar collaboration initiatives across the 36 states and the FCT?
Yeah, so I mean, I have to give a lot of credit to the Ogun State government, particularly the Ministry of Health, led by the Commissioner, Dr. Tomi Koka. They have worked hard over the years. Unlike many states in Nigeria, they actually have had a functional emergency services system to date. But this has really kind of layered on top of it to take that system and help it to penetrate further into rural areas. And I think what I've seen is that the federal government is making a lot of effort to create the enabling environment for such systems to not just thrive at, kind of a small local government level, but to expand across the country. So through things like the Basic Healthcare Provision Fund, the NEMSAS, National Emergency Management System and Ambulance Services, those are programs that are creating the infrastructure that other players like ourselves can partner with state governments and layer on top of. So my hope, and I mean, I'm glad to be having this type of conversation, is that at the federal level, there'll be a lot more look at, okay, how do partners come in to work with the government to expand these systems into other areas?
So how do you envision the role of telemedicine in supporting emergency healthcare for Nigeria?
Yeah, that's a great question. And I think there's a big role to play. I will also say that because our emergency system is in such an early or nascent phase, we haven't quite gotten there yet. But when you think about the fact that as a country, we have a low level of human resources for health, and that number is ever going out, people are jackpying, as they say, it becomes more important to not just train people locally, but also give them access to talent so that when they're in the field providing care, if they need that extra support, they need decision-making capacity, they can get on a telemedicine platform and connect with a physician or somebody who has a higher level of expertise and receive that support. So that's one of the ways, in which I see this going in the future.
Folake Owodunni, co-founder and CEO, Emergency Response Africa. Thank you so much, madam, for the great work you're doing on the ground, saving lives. Thank you. We appreciate it. Have a great weekend, madam.
You too. Thank you.
We appreciate it.